Chairman Barrett, Ranking Member Budzinski, and subcommittee members, thank you for the opportunity to discuss the OIG's oversight of EHRM. Since April 2020, we have published 22 reports on VA's modernization program. More than half uncovered significant patient safety concerns, such as problems with medication management, pharmacy operations, and patient care coordination. The others identified deficiencies in program and contract management, including poor cost estimating and reporting. We have remained focused on EHRM during VA's reset because an updated EHR has a central role in providing high-quality health care to veterans. I want to discuss 4 main unresolved issues previously identified by OIG teams that VA should address as it emerges from reset to the next wave of EHR deployments. First, while VA has addressed many OIG-identified patient safety issues, more work is needed to ensure that the veteran's experience with the new EHR fulfills its promise of timely access to seamless, high-quality care. For example, the new EHR has had serious issues with handling scheduling changes and missed appointments. This includes VHA allowing mental health staff at new EHR sites to make fewer attempts to contact no-show patients compared to legacy sites, creating a different standard of care between sites. VHA should address barriers created by software deficiencies without compromising patient care and engagement standards. Second, in February 2024, I testified to this subcommittee about pharmacy-related patient safety issues facing every VHA provider. While VA has made progress on some aspects of the pharmacy program, critical issues remain unresolved. For the foreseeable future, legacy EHR site leaders must have providers perform manual medication safety checks for patients who have received care at a new EHR site due to concerns with the automated process. These manual safety checks are time-consuming and rely on the vigilance of pharmacists and frontline staff. Facilities using the new EHR require greater numbers of staff and supplemental resources to manage this significant drop in productivity. Third, it is essential that the new EHR system be consistently accessible. In September 2024, the OIG found that VA procedures lack sufficient controls to prevent, respond to, and mitigate major performance incidents. While we recognize VA has improved system reliability, there are still incidents occurring every month. Given the stresses the system will likely experience during the next deployments in larger facilities, VA must be ready to handle any future instability and equip providers with the tools to continue working when the system is degraded or inoperative. Finally, VA must develop and maintain an integrated master schedule to clearly track and project the program's cost to completion. The 2026 deployments are on a much larger scale with a greater number of variables and tasks to plan and execute. Also, VA's ability to train staff and resolve requests for help may be challenged. Additionally, there may be many developments over the next year that could affect the schedule, costs, or the veteran and provider experience. A reliable master schedule will enable VA to be fully transparent with Congress and their stakeholders about what needs to happen for the successful rollout of the new EHR in Michigan and other sites nationwide. Our recommendations on the integrated master schedule and project costs have been open for several years, paused essentially because of VA's reset. Given the restart, VA should get them done. Without them, costs will be uncertain, risks may not be mitigated, and efficiencies could be lost as tasks dependent on other actions are not fully considered. In conclusion, EHRM's success is dependent on VA's transparency, careful planning, and the recognition and remediation of patient safety issues. Updating the EHR is critical for VHA's ability to deliver health care in the future. And the OIG will continue to focus our resources to provide VA with timely recommendations that can help them and Congress ensure this transition succeeds. Chairman Barrett, this concludes my statement. I would be happy to answer any questions you or other members may have.